Mr. Superintendent, if you'll start off by calling roll for the record.
Mr. Lejeune?
Here.
Ms. Mason? Ms. Mason is absent. Mr. Hidalgo?
Present.
All right, we have a quorum.
Great. We'll jump right into it in the interest of time. Item 2.1, review and approval of Lafayette Parish School Board Board Insurance Committee meeting minutes from July 3rd, 2024. Mr. Lejeune, I don't know if you've had a chance to look them over. If you did, we can get a motion to approve those minutes.
Yes, sir, I did. I'll make a motion to approve.
And I'll second that. Is there any public comment on that motion? Hearing none, Madam Secretary, please call the roll.
Mr. Lejeune? Yes. Mr. Hidalgo?
Yes. All right, that motion carries. Item 2.2, Group Health Insurance and Related Benefits Consultant Introduction and Account Update. Ms. LaBeouf?
Good morning, everyone. My name is Trish LaBeouf. I'm the Director of Insurance and Benefits. I would like to introduce you to the new team that LPSS has for their group health insurance consultant and related benefits. That is Miss Kim Bernard. Miss Kim, I think I pronounced your name wrong. Please correct me on it. And Miss Angie Landry. They're just going to give you a brief introduction of where we are and where we've been since the board approved the new consultant effective July 31st, and just answer any questions that you may have.
Thanks, Trish. That's okay. Good morning, everyone. It's okay if you pronounce my last name. It has a French flair to it, so it's Briard. My name is Kim Briard. I'm with Gallagher Benefit Services, a consultant assigned to the Lafayette Parish School Board account. And we like to, thank you guys for awarding us the contract. And we've been working pretty quickly since July 31st. When we were awarded. So a lot of things have taken place, and we just want to provide you an update in where we are today, what's happening within the last week, and answer any questions that you have. So, Angie, you want to kind of give us an update?
Yes, Ms. Christie should have handed you out a little packet that we're going to just use for our notes. Again, like Kim mentioned, I'm Angie Landry. I am your lead consultant on service day-to-day. I'm located right down the street from you guys. I think you know where to find me. But I did include on the second page a list of all your Gallagher team members, our contact information, cell phone numbers, and email addresses. On the next page, like Kim said, we received the broker of record, our appointment on July 31st at the board meeting, and we began working right away. The broker of record letter was sent by Ms. Trish to the carriers on July 31st, and Gallagher contract began 8/1, which we sent to Ms. Trish, who she is working with your legal counsel to make sure all T's are crossed and I's are dotted. So at that moment, we don't have the signed contract back, but we know Ms. Trish is working hard on that. We have requested on the next day, August 1st, we requested all the carrier data from Blue Cross, from Humana, from all the pharmacy vendors. We requested all the data. We are asking for 5 years of data. We can work at 3 years, but we'd like to go back 5 years. So at the moment, we don't have 100% of the data from all the carriers, but those are being worked on. I do have percentages from each carrier that I'll give you in a second. We have, your Gallagher team has engaged with our pharmacy team. We have engaged with our underwriters. We have engaged with our analytics. We have had calls. They're all in the process of creating and building the worksheets that will be used for LPSS. We have scheduled and spoken to a few of your carriers already, but we have scheduled upcoming carrier calls just to get the information that we need and possibly speed them up with all of the carriers. We had our call with Blue Cross. We've had our call with Humana. In the future, and this week and next, we're having the PBM calls as well as your COBRA vendors. So everything has been in the works. There's a lot of calls and appointments going on right now. Your stop loss coverage has gone out to market. We received everything on Monday, so that is already in the process of being requested from all the carriers. Blue Cross, we have approximately 95% of the data that we requested. Humana, we have about 70% of the data. RX Benefits, which is one of your PBMs, we have 95% of their data. And CVS Caremark, we have not received anything yet, but we have been told they are working on it.
Yeah, and Angie, this morning on my drive-in, we actually received a email from CVS Caremark. We are uploading all the data into a share file, so it's a secure system with all the data, and the representative at CVS Caremark just forgot to press a purple button to get it in there. So he acknowledged that. We should have that this morning. But again, we got the email this morning, so I'm pretty confident that we'll have all of that by the end of the day today.
Yep. And we're hoping to have 100% of the clean data by no later than Monday. We're hoping for Friday, but no later than Monday, we should have all of the clean data. Clean data meaning everything that our underwriters, our pharmacy team, our analytics need to begin the work. On the next page, it just shows we have a checklist of what we use that consists of a couple of different pages, but this is just a snapshot of the medical portion of the medical checklist, which we call it, of the data that, it's been requested, and as it's a work in progress, so this is updated as the information is received. So it gives us a items check-off list of what is needed, what we requested, and where we stand on it. So I just wanted to give you a little snapshot of what it looks like. Do you have any questions for me? No? Kim, you have anything to add?
No, that's it. We just wanted to provide you guys with an update so far.
Well, thank you for your time. We appreciate that you guys have jumped right on this, and
Yes.
we'll be looking forward to seeing you in the upcoming months, certainly with a lot more information and decision making. So thank
Yeah.
you for your time this morning.
All right, great,
Mr.
thank you.
Hidalgo, can I make a
Yes.
Okay, so, board members, I just want you to know that, again, I want you to know that we're working fiercely about making sure that this data, if we get all of this data within 7 working days, I think it's going to be a phenomenal turnaround. So, again, Gallagher has started even after that day 1 of getting this stuff in. I want you to know, and you can expect to call me at any time, that we're going to have conference calls every 2 weeks with them, just to kind of just know where they're going with this. And we really want to make sure that we can look at it from this perspective. What are those low-hanging fruit that we can tackle right now to be able to make some differences as far as our budget's concerned? So I'm very impressed with what you guys are doing. Continue to work towards getting that information. Our board is very much looking to make sure that we are showing that we're going to make a difference for our retirees and also our active employees.
Yes, sir.
Yes. Thank you.
All right, item 2.3. Discussion and action regarding the Fund 85 budget report. Ms. LaBeouf?
Good morning, everyone. Ms. Gardner, can you please just put up that budget to actual revision that was approved by the board at the 7/31 board meeting, just so I can talk through a couple key points and make some annotations, please.
Ms. Holly, will you be able to pull up my screen? Thank you.
So let me just tell you what you're looking at right here. Again, this is the budget to actual revision that was approved by the board at the last board meeting on July 31st. So we are currently in the midst of having numerous conversations with the accountant. We've been in the process of trying to wrap up fiscal year 23-24, which ended on June 30th. And we are in the process of working towards fiscal year 24-25, which is effective July 1st. So there's a lot of moving parts here as we try and wrap up one and begin the next. So I thought it would be best if we at least just talk through the budget to actual so that I could bring financials back to the Board Insurance Committee and just tell you the important pieces while still knowing that these pieces are very fluid and it will still take a good another month to wrap up these, wrap up the final information with regard to fiscal year 23-24. So with that said, currently the auditors are completing their adjustment entries incurred during the previous year, fiscal year 23-24, and the budget is still being finalized. With that being said, when I come back at the September 18th, to which we are going to send out the Board Insurance Committee for September, the date has changed. We were waiting till the meeting today so we didn't confuse members to make sure that they were aware that the next meeting will be on the 18th of September. We're sending out communications on that come Friday so that when I come back to you in September, I'm going to have a lot more information to provide for you too, but I wanted you to at least have some visuals and some takeaways. With that being said, I'd like to just focus on those two important pieces with regard to medical and pharmacy. The year-to-date actual expenses under medical are the $41 million. Pharmacy currently, as of 7/31, was coming in at $29 million. Keep in mind, these numbers are still fluid and we're finalizing everything. A total $78 million in total expenses, where the year-to-date for revenues currently as of July 31st was the $69 million. The current deficit projections for fiscal year 23-24 as of the date per the 7/31 is coming in at around $7.9 million, which is inclusive of the $1.2 million pharmacy management fund with RX benefit. So that is including that $1.2 million. As you'll note on here, if you look across and you see that net operational gain and loss, there is a $5.6 million general fund transfer from general fund to insurance fund. So let me just try and talk you through that so you understand what's being presented to you. Based on the current deficit projections remaining with a fund balance of $4.9 million, if you note just 2 lines below that, you'll see the beginning fund balance of 4.3. And the projected lag in claims, not yet incurred for fiscal year 23-24, because we're still working those through over the next month. The general fund has made that one-time transfer. I wanted to make sure to emphasize one-time transfer of $5.6 million to the insurance fund. We are hoping that at some point we will have a healthy fund balance to where we can take a look at any monies that were given to us from general fund. But for right now, it's just a one-time money. I wanted to overemphasize that piece. We are, based on additional projections that we are still working through over the next month, there could be a possible $1 million additional transfer from the general fund to insurance fund, with a total of at least $6.6 million from general fund to insurance fund. So I just wanted to emphasize, the important pieces under the expenses and the revenues, tell you that everything is still fluid, in particular with the Blue Cross expenses, because those are under a lag. We're still trying to work those through for the auditors. That way we can properly assess how much money may need to be transferred. And then also tell you that when I come back in September, there'll be more details on both fiscal budgets to give you a better idea of where we're landing.
The premium increase and benefit reduction, it resulted in approximately how much?
So the active payrolls have processed through. We were projecting about $410,000 per month over the course of the next year. I'm sorry, I'm sitting here trying to think that through real quickly. So roughly 4.9 in that example is what our projections were. Keep in mind, that too's fluid because it's based on membership at the time, based on no changes happening under qualifying events or open enrollment, which open enrollment will affect it if members change from one plan to the other. But we currently have active payroll that's processing through, but the billing for the retiree pensions under the Blue Cross has not yet posted to our ledger accounts under Fund 85. So I can see the active information, but not the retirees just yet, which is why I said September, we'd have a better idea. Does that make sense?
So we've been kind of juggling on the ultimate number. We see 5.6 has already been transferred. You're predicting potentially another million something. 4.9 is what was the offset, with increased premiums, reduction in benefits. So if we round up, that's 5, that's 10.6, that's 11.6. So we're well over $10 million deficit at this point. We don't even know what the numbers are, but we're well over $10 million in deficit.
Keep in mind that the 4.9 that we were just discussing was inclusive of the fiscal year 24-25 budget, to which when we brought it to the board, we ended up with a 6.6 million, if I'm remembering correctly, deficit that the board approved when we approved the budget for fiscal year 24-25.
But the 4.9 just put us breaking even for 24-25.
Not breaking even, but it was inclusive of that total, which when the board approved it, did still have a deficit, 6.6, if I'm remembering correct, or 6.7.
Okay.
Mr. Hidalgo, and again, and I'll say it again that, right now, we just had yesterday a long-term facilities meeting, and I will tell you that we went and toured LJ Alamo, which is one of the biggest middle schools that we have in the parish. And part of the reason why we tour these facilities is because of what we see when we go there. And I'm going to tell you, it's probably one of the worst I've ever seen, and I've been saying this for the last 6 years, that we have to do something. When I talked to Matt Duga about, and I'm going to talk to him today, how are we going to meet the needs of what is happening in these schools that, by all means, lots of kids are going to LJ Alamo. We got a waiting list of kids there. And the facility that we're putting kids in there, this is monies that we could be using for building facilities and trying to go out and do different things. So I'm going to really, again, emphasize to our carrier, our consultants and our team that we can't continue to be in this situation year after year, because we have facility needs that have to be met, because we have kids that are going into facilities that I would be embarrassed to show the public.
So what I'm trying to find out, Ms. LaBeouf and Mrs. Superintendent, and look, we're probably not going to get it today, but some point very soon, I am trying to find out, regardless of any transfers, any offsets, any parachutes falling out of the sky, just regardless of anything, what was the amount of deficit 23-24 fiscal year for the insurance fund?
Currently, right now, we're landing at 7.9 is where we currently are based on the 7/31 budget to actual. That number's going to be more, I can tell you, because we still have August claims and billing coming in from Blue Cross, which we're projecting about 3 million of that could be posted for last fiscal year, 23-24. But we're still working that through. We had 3.2 million in claims for July. We did a rough estimate, 3.2 for August is what we were thinking. Now, the last bill that came through yesterday for the weekly claims was lower, which was wonderful. Lower in the sense that we were within budget, 720,000 versus it being over $1 million like we've seen over the last couple of weeks. So right now, I'm telling you 7.9, but I'm going to come back with that number being larger.
Mr. Hidalgo, address Ms. Trish. Hey, the deficit that you're talking about, is that before the premium increase, or is that including the premium increase?
Keep in mind, I'm specifically referring to last fiscal year's budget because we're trying to wrap it up. When I bring you back the new budget beginning July 1st, that will be with the premium increases in it because we did initiate premiums as of July 1st. So I can see those numbers coming through now based on payroll. because members pay the group health insurance a month in advance. However, retirees are in a lag in the sense that we receive the monies from pension. However, they still need to post to the accounts so that we can make sure that we're on track with those projections that we made during budget season.
About how many retirees a month become Medicare eligible and jump at 65?
Ashley, you may correct me on this.
Anywhere from 10 to 15, maybe. I mean, and that's on the high end, it just depends. I mean, it's all based on birthdays, so if you have a lot of September birthdays that year, then there's a lot of Medicare rollovers. Sometimes it's 5.
I hate to do this, but if it were just a one-word answer,
Yep.
that would be fine, but we need that on the record. So if you could please come to the microphone.
Come see Ash.
Good morning, y'all. Sorry. This is Ashley Wright. And yes, so the answer to that question would probably be about 5 to 10 a month, roughly. It could be more, it could be less, but on average.
It's based on their birthday, is
Yes,
what you were
ma'am.
noting. We are working through and notifying those members. We get a report monthly from Blue Cross. We reach out to them and tell them, hey, this is a reminder the district does have a mandatory A and B moving forward after the budget board adoption. And we are starting to track those members. That way we can make sure that they are complying with that mandate.
All right, good. Thank you.
Thank you. Any other questions? That pretty much sums it up for right now. It's a brief summary. I at least wanted to put something before you that was official. That way you could take a look at the numbers and where we're landing. But again, it just takes a good month or so after the fiscal year budget has ended in order to work through everything under the final calculations so that we can come back with you with more solid numbers.
All right. So if there's nothing further on this agenda item, Mr. Lejeune, if you would kindly make a motion that the board committee accept the monthly Fund 85 budget report.
Yes, sir. Okay, I'd like to make a motion that we accept the fund report, the Fund 85 budget report.
Of course, I second that. Is there any public comment on us accepting that report? Hearing none, go to vote.
Two for, none against.
Motion carries. Item 2.4, discussion and action regarding the Insurance and Benefits Department staff report. Ms. LaBeouf.
Okay, so we have heard the concerns of the retirees as they've come to the podium to make note that they want direct communications. We are trying to offer that piece in the fact that we do a lot of the primary communications via email. So we went back and took a look at the number of individuals to which we did not have an email address on file so that we could communicate. There's roughly 600 retirees that did not have an email address on record. We had more retirees that had at least a cell phone on record. I think we were short about 40 members in that instance. So we've been trying to perform multiple forms of communication to include text messaging, emails, calls to remind people to either check their email or take a look at their text message. But our primary form is electronic communications. So with the 600 members, we produced a one-pager. We sent it out to those members and asked for a couple items, essentially reconfirm your address. We had one piece that was missing, but reconfirm your address. If you would please give us an email address, and if you don't have an email address, then if there's a trusted family member to where you could list their point of contact information, that way we would make sure that that family member would relay the information onto the retiree and they could get it timely. We did ask for a family member's point of contact as well. So I just wanted to give the board an update with regard to it. We did ask them and remind them that if, A, they didn't have an email, perhaps they didn't want to include a family member's email, that we did give them a reference point to refer to on the department website that told them exactly where they needed to go, because every single time we do send retiree communications, we post to the website. It's under a drop-down under communications for 2024. So we gave them a couple different resources within that communication. So I just want to give you an update. We sent the mail out on 7/15, July 15th. To date, as of yesterday, we received back 203 have been returned. 84 did not include their email addresses. We have a total of 95 new email addresses. 23 were undeliverable, so we're still trying to research those further and see if we can at least obtain an address. That way we can reach out to them. We were luckily notified of a member who has since passed away. That way we can work through the life insurance information with the beneficiaries on record. So it was, in my opinion, a helpful communication. We're still continuing to receive them. We're still going to try and update our info. But again, I'll just encourage retirees to please stay connected with the district. If at all possible, please give us some form of electronic communication. That way we can make sure that we're communicating with you. And to be on the lookout for future communications from our department. We try and send them regularly. We'll also be updating members this week with regard to the changes in the September Board Insurance Committee meeting. Do you have any pieces?
When anyone calls your office, but in this case, let's just say a retiree calls your office and everyone's busy, what happens? It goes to whose desk when someone leaves a message?
Typically, we try. Ashley Wright is our retiree specialist. Obviously, they've got Ashley's point of contact. If for some reason Ashley's not available, they have reached out to other members within the department. We strongly encourage them, leave a voicemail. If we're not available, Ashley has ongoing regular appointments carved out in her daily schedule. She does certain days of the week for appointments specifically where it requires longer conversations, but we ask that the member leave a voicemail. If they just ring the phone rings quite a bit, so it requires the voicemail. That way we can connect with the member and try and answer their questions.
Yeah, so we can't control what the member does, but I guess you guys are controlling what you do. I guess what I would suggest, we've heard from folks. I don't remember hearing from an individual that came in and said, I'm a retiree and I never received the communication. Mm-hmm. But we've heard from others that they know folks who are not receiving the information. I presume that it's a direct contact with that person and not it's just being a pie in the sky. So maybe if we send out a detailed, very brief, helpful, instructive, piece that says, hey, if you know someone who is not getting our information via text because they don't have a cell phone, via email because they don't have an email, could you please, obviously you're talking to them, could you please ask them to call this number so that we can make sure that we put them on whatever list they need to be on? If they need to be on our short mail list, if they need to be on some other type of communication system. And maybe that could be helpful, because if someone comes in here and says, well, I know a retiree and he or she is not getting the information and, you guys need to be mailing everybody. No, if you know a retiree, have them call us so that we can figure out how to handle it from there. Is that something that you guys?
We can definitely send out something to members and just remind them. And I believe we've had this discussion a time or two publicly too. That way it's been, if members are watching the videos, then they're realizing it too. But yes, we can certainly send out something and just say, please connect with your fellow retirees. If you know of somebody who is not receiving our communications, ask them to reach out or give us their point of contact, and we can certainly reach out to them and get them engaged.
Okay.
Yes, sir. Okay.
So, kind of rewind just a little bit. Last month's report, when you reported to us on the monthly claims numbers, I knew that you stated to us that there was a lot of backlog from the Ochsner Blue Cross situation. I know that there are still some claims outstanding, but did I miss monthly numbers from some of that impact, or was it not presented today?
You talking about Blue Cross claims in particular?
I'm talking about, we knew that the numbers were much lower in last month's report because of the several months of no claims coming through from the Blue Cross Ochsner contract ordeal. And so I was very hopeful that this month, one of the biggest reasons I wanted to make sure we had a meeting, timely this month, was to get some of those numbers of where we are in that huge lag. Now, certainly you've got us a year to date, and I appreciate that. That's important information. But do we know what that impact was, or at least the majority of that impact? Because I think we were at, I don't know what the number was, but let's just say we were at $1 million or $800,000. We knew it was a much lower number because you still hadn't received those claims from that ordeal between Blue Cross and Ochsner. Am I making sense to you?
No, I'm following. So, to my understanding, when that occurred, we have wrapped up a large majority of those claims and billing. They pushed them through right after the last time Hub came and reported. They came through upwards of 4 to 8 weeks. From what I remember, they were on the tail end of wrapping up because our claims and billing have decreased. But I can certainly double back. At the time, Hub was managing that piece, providing the data to LPSS with regard to it. But we can certainly take a look at it. We could double back to Gallagher, and we can ask in particular with regard to the Ochsner claims.
The year-end report is great, but one of the big reasons to make sure that we're having monthly meetings is to make sure that we're getting the monthly numbers and updates. And so I was not excited to wait and see the number, but I'd like to know what that number is.
In particular with the Ochsner, correct?
Because I know that we still have some lagging stuff. You mentioned this 78.1 million is it's not our number.
No, it's not. I can get that information. I can provide you with an update, and we can double back to it. The problem right now is everything is so fluid, but yes, I can certainly get you that info. And then just my last piece, if there's anything else. I just wanted to advise the Board Insurance Committee with regard to the Employee Retiree Insurance Advisory Panel, which is the Superintendent's Advisory Panel with regard to insurance. It was essentially, according to Board Policy BBC, it was created to bring stakeholders together who are committed to ensuring group health insurance benefits offered by the district bring value to the employees of retirees of LPSS. So we do have a total of 13 members who began on July 1st of this year. We are going to have a total of 4 quarterly meetings to where we will meet with the panel and have updates and conversations and bring topics to them to ask for input. It is consistent of 5 retirees and 8 active employees. That ratio is determined by the employees to retirees enrolled in the open enrollment plan at the end of the year, of any given year. So we circle back to the open enrollment numbers at the end of every year, and then we would reassess the ratio of retirees to actives based on those totals. But essentially, the panel is a mixture of members who have different group health insurance plans to include Blue Cross and Humana. They had to have LPSS health insurance in order to be a part of the panel. A survey was sent out to interested volunteers, to which the superintendent selected a panel of members. We did have our first meeting on July 30th and met the new group of members, and our next meeting will be in October. So I just wanted to give the Board Insurance Committee an update with regard to those changes.
I know Ms. Lejeune was there as well, but I attended that first meeting, and I want to say, Superintendent, I believe that the committee that was chosen, or the advisory committee that was chosen, is, it's a continuation, strong folks, with the vested interest. What is your ultimate goal from this group? I mean, what do you envision? What do you want to get out of this group over the next year?
So I think the very first thing is, just like in any advisory panel, is that The retirees that are on that panel and the active employees there, they are our voices. So what I am asking is that every retiree know who is on that, give us that information as you guys see it needs to come to us, to where they could bring it to that particular area where we actually get a voice from retirees and our active members. So Trish, my question would be is that does every retiree understand who is that representative on our advisory panel? And number two, are all of the active employees aware of who those active employees, to where they could contact them, they would have their emails, so that we can always have that constant, just like our teacher advisory. I mean, we can't reach 2,200 teachers, but I can tell you this, we have 46 teachers that are going to be the people that are on those campuses that will grab information and bring them back to us. So, Mr. Hidalgo, to answer your question, it is clearly to have a voice from every single one of those active and retirees, so that we can bring that information to me and our team, so that we can kind of hear what is going on out there, or what they feel like we need to kind of focus on.
So, yes, sir. We send out a monthly department newsletter the second Wednesday of every single month. The active members are engaged in that newsletter, and we will be adding the panel information to that August newsletter that we have going out. It is also already currently updated on the website, so it's already there. With regard to the retirees, yes, we still plan on sending out an informational directly to them. There is a retiree Facebook page to which a lot of our retirees are a part of, to which the administrator does have the one-pager. She has already distributed it there because she made the request. But yes, we will make sure that both your active and your retired members have that information. That way they can connect. We listed email addresses with the preference of the panel members, so that they could communicate with them via email if they needed to.
And I appreciate being part of it. Those people are very knowledgeable that sit on it, and it's a great learning experience for me being new to this. So I do appreciate that y'all include me. Thank you.
Yes, sir.
Does that conclude?
That does conclude everything. Yes, sir.
Okay. Mr. Lejeune?
Yes, sir. I'll make a motion that we accept the staff report from the Insurance and Benefits Department.
Second. Any public comment? Hearing none. Madam Secretary?
Two for, none against.
Motion carries. I want to thank Gallagher representatives, and thank you, Ms. LaBeouf, as well, for your presentations today. I want to make a reminder, our next month's Board Insurance Committee meeting date has changed. The new date is September the 18th. September the 18th, 9 a.m. in this boardroom. Please spread the word, and happy first day of school. With that, this meeting is adjourned.